Hey guys. So I wanted to talk to you about something that happened when I was in the hospital at, well, in the middle of last month, and some information that I received while I was there. So I had another TIA, a mini stroke, and I was in the hospital for a few days again. I was working with speech therapy, occupational therapy, and physical therapy, as I have every other single time that I've had a mini stroke. And this time, my foot was doing something different. Like I've showed you guys on my channel before, like the physical therapy exercises that I was doing, and kind of the progression from not really being able to walk to being able to walk semi-normally. For the most part, I'm able to get around pretty normally. But like, if your feet are like this, what my foot was doing was when I would stand up to try to put any weight on my foot, this foot would turn in. So it would be like sideways, which I had no control over. I I didn't have the strength to turn the foot back how it was supposed to be. So this foot would be normal, but when the physical therapist would try to get me to stand up, this foot would automatically go like this. And so basically, she told me that I really need to get an AFO brace on that right side, which is a little frustrating because right now my insurance is acting all crazy. For some reason, the hospital was having difficulties trying to find my insurance coverage, and I'm not sure if that's because I just recently got married and changed my name. But it's just kind of annoying because I'm trying to get like my health together and get my shit together, so to speak, but I can't really do that because like medically I can't even get the treatment that I need due to insurance and the hospital not being able to find my insurance even with my social security number. Like, I have United Healthcare, she ran United Healthcare with both names and she couldn't find the coverage that is active through my job. So it's a little frustrating, but the occupational therapist worked with me as far as my hand goes. I am supposed to be wearing a brace on this hand because I do lose control of this hand. So like when I'm sleeping and stuff, it sometimes ends up like underneath me if I turn in the bed. I don't necessarily have full strength with this hand. Coming back from this most recent mini stroke, it's been kind of frustrating because like I feel like this mini stroke, I'm not like snapping back to myself as quickly as I did before. And it's just a little bit frustrating. And I don't know if that's just because of the mini stroke. Like, this is another mini stroke in a long line of mini strokes over the past few years. And I've been trying to also figure out like what in my life is causing me to have multiple mini strokes. And I've been trying to change my diet. I have been losing weight. You can't really see it as much in my face, but I notice it a lot in my torso. So I'm just kind of, trying to change different things and see if my health improves based on the changes that I'm making. And I don't know, trying to figure out a way to get the AFO brace that I need. I do have a wrist brace. I have a couple of wrist braces that I use, which do help. I have an orthotic brace that I can actually use for when I'm sleeping. And if you guys are interested in seeing like the braces that I'm using, I can show you guys that in a separate video and kind of talk to you more about like the issues and the frustrations that I'm having with that. So let me know if you're interested in hearing more about that. I just need to figure out how to get the AFO brace because I do have a temporary one, but it's not like molded to my foot. Because when my insurance was like, everything was situated with my insurance before, I did go for a consultation to get an AFO brace, because my MS doctor actually wanted me to get AFO braces for both feet. But the physical therapist said that I definitely need one like ASAP for my right foot just because of how it's like turning inward. And it's like a lot of issues with when I'm trying to walk. My foot is dragging again. I have drop foot and it's just really frustrating. So I don't know if it's just because of the mini strokes that I've had over the last year to 2 years, or if it's a combination of the mini strokes and kind of the damage that was left behind from those, and then also adding into it like my MS and some of the issues that I deal with when it comes to that. I'm not exactly sure if they're probably both playing a part, let's be honest, but it's just a little frustrating when you're having like insurance issues and they're not able to find the right information so that you can get what you need. I'm definitely trying to make sure that everything works out for the best, and trying to get a different job because I do feel like my job is kind of contributing to some of the issues that I'm having as far as stress and health wise. So it is a little bit frustrating, but I just wanted to talk to you guys because, you know, you've seen me kind of go back and forth and struggle with certain things with my health. And I feel like this is just another hurdle that I'm going to have to try to figure out how to overcome because I don't know how to like fix it without, you know, just completely losing my mind. Because that's what I feel like I've been doing lately with all these health problems and then bullying going on at work again. This is a completely different job, but I'm having bullying going on at work again, and I'm sick and tired of it. And I just don't know what to do sometimes, and it becomes overwhelming. So yeah, anyways, that was kind of a bit of a rambling video, but yes, I do need an AFO brace, at least for the right leg, if not for both legs. And hopefully I will be able to kind of show you guys the process of getting the AFO or AFOs, depending on if my MS specialist is going to approve me for both legs, and plus figure out all these insurance issues that I'm having. So we'll try to figure it out and hopefully get some good news coming soon because I need some good news in my life. I have a job interview tomorrow, and you know, I'm still waiting for the state of Indiana to switch like my licenses over to the new name, and so it's like confusing. But anyways, that's another video. So anyways, I need an AFO. Hopefully my health stays good enough for long enough to be able to make some good money, to have some better money coming in. But if not, then I just got to do what I got to do. So anyways, I hope you guys are having a good day. If you have any questions, anything you'd like me to talk about or elaborate on a little bit more, please let me know, and I will do my best to address it. And with that being said, I will talk to you guys again in my next video.